In the ever-changing world of healthcare, are you looking to get advice and learn to prepare for healthcare challenges that you may face? Come join a conversation about all things healthcare and wellness with your hosts, Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Monsi Shaw.
Welcome to the Healthcare Corner, everyone. And today is going to be, I think, another great episode here on the Healthcare Corner. We've talked so much recently about preventative health and wellness. We've talked a lot about exercise and diet and all the things that go into it. But I think today we wanted to get specific and address some issues that maybe many of us deal with. And so I think today we're looking at blood pressure, blood sugar, and cholesterol, putting things together. If you're not new to the show, you know that we've got our podcast that you can download at any time on hcshow.net, or you can go to wherever you get your podcasts and download our episodes on hypertension versus hypotension and other things there. But Dr. Shaw, Dr. Castillo, we're going to have a great time today.
Yeah, I'm with you, Gavin. I'm excited because, like you said, it's a little bit different, right? We're gonna really attacking elevated blood pressure, elevated cholesterol, and elevated blood sugars from a different standpoint. Is it, really, is nutrition the way to go when it comes to treating these things? I'm not talking about the diagnoses of hypertension, of diabetes, or hyperlipidemia. I'm talking about just having elevated values, what that means, because most of us are used to waiting for a diagnosis, but that's, again, reactive medicine. So here we're all about proactive medicine. So how can we get on top of these things? And then Dr. Shaw's going to lead the way on how do we really attack it from a nutritional standpoint so that maybe we don't need so many drugs?
Absolutely. And that's what I am an expert on because of my functional practice. So let's get this started and give some really valuable pearls to our audience here.
I think so. So we'll get into it. And as you all know, I love bringing some stats. And so when you're looking at hypertension, nearly half the adults in the U.S., or 47% of the population, have hypertension as defined by their systolic blood pressure. So that's greater than 130 and a diastolic blood pressure of greater than 80. So let's start right there. So if we want to reduce all those medications that people have for their blood pressure, how do we start? What kind of foods do we need to start looking at?
Well, even before we get there, like you said, once you have a diagnosis of hypertension, because nowadays to really get a diagnosis, you have to have had, more than one elevated blood pressure on different occasions. And, as we've all heard about sometimes, and I've seen it in my office or, even in the hospital setting, where as soon as the doctor comes around, the blood pressure goes up. So they call it, a white coat hypertension. Right, all this, but yes. To truly get a diagnosis of elevated blood pressure or hypertension, you have to have, like I said, multiple readings at different times and different settings, so that you can say, somebody. That's because you're going to give somebody a prescription for a medication that doesn't come without consequence, right? So you have to be sure of a diagnosis. But I'm really concerned today. I think we should really attack blood pressure from, hey, what is really a high blood pressure? Number one. Is it really what the standards are for hypertension, or should you be more concerned at lower levels, and why? Right. So before we even get into those foods, I'd like to attack that. So I don't know about you, Dr. Shaw, but I've read somewhere, and I don't recall where, that having a blood pressure is elevated. I'm talking about only over 120 over 80, right? So a diastolic of 80 and a systolic above 120 puts you at much higher risk for developing dementia. It's probably vascular dementia, obviously. But it was something like 60% higher in those people who consistently had blood pressures, even in the 120s, right? So to me, that's very scary.
It is. And that's why we should focus more on diet, nutrition, and lifestyle, and not just completely rely on medications.
Yeah. So, for me, elevated blood pressure, I've also seen in people who have not had a diagnosis of hypertension specifically, come in, and by the time they come in, we find that they have a cardiomyopathy, meaning that their heart is thickened and enlarged. Because if you remember, right, blood pressure is resistance for that heart, right? So if you have an elevated blood pressure, even if you've never been diagnosed with hypertension, your heart still has to push against that resistance. So just like any other muscle, when you're lifting weights, it gets bigger, right? So that's how we found high blood pressure. Is people have an elevated, like say a diastolic number, and you're like, why is that? And so you start doing more studies and you find out they have a really enlarged heart. So even though they've never been diagnosed, because just like there's white coat hypertension, there's also white coat hypotension. Some people, blood pressure is actually, when they go see the doctor, lower a little bit. So they, you don't ever capture them, right, as being elevated. So they end up with these enlarged hearts, and that's how they show up. We also, with kidney damage, nephropathies, or like you said, start having because the blood pressure is elevated, you start having these little micro infarcts in the brain, and they show up with memory issues, so dementia-like symptoms. So that being said, how do we keep those down? So Dr. Shaw, what types of foods, as Gavin alluded to, will bring those blood pressures down, and why would it be important to incorporate those?
Absolutely. So food-wise, I would make two separate type of charts, whereas what types of food to actually include in the daily habits and what type of foods to avoid, because at times avoiding the wrong toxin overloaded foods also really helps the body with focusing on actually keeping the blood pressure in check rather than putting the resistance and the load on the heart and the kidneys, if that makes sense.
Yeah, absolutely. It makes a lot of sense to me. So, but just for, for audience sake, how does, having elevated blood pressure put it, I mean, we can understand on the heart, because I think I kind of explained it, but for like the kidneys, or, how the kidneys and maybe the brain, why would these be affected by elevated blood pressure?
Well, because everything is interrelated, and our excretion method is through kidneys. So what happens is when there is toxin overload and the blood has to actually be circulated with these toxins, heart has to put in more work, and so does kidney with excretion, and then neuroinflammation happens because of toxins going into the bloodstream. So there's so much of this intercorrelated mechanism that's happening, which is causing inflammation on different levels and different organs. And that's why it's a silent killer, because we don't know until there is a major episode of someone having complete memory loss, or, eyesight being lost, or even kidneys being damaged. That's when a lot of people find out that they have major crisis with hypertension. A lot of times people are just kind of roaming around with high blood pressure and they don't even know.
Yeah, absolutely. So what kind of foods here that are common, things that we may not even think about, that people would be like, wow, I can't believe that, but that brings down blood pressure in your experience?
In my experience, I have used hibiscus tea in the last 10 years with blood pressure, and I've had a lot of good results. So hibiscus tea without, of course, sugars, because you don't want to put toxins in it. So you could sweeten it with agave or maple or even raw honey if you want to, because it's a bit tart. And this has been used for all, like I would say, hundreds of years, if not thousands, in Middle Eastern countries. And there are studies now proving that hibiscus tea can really help with regulating blood pressure naturally, which also doesn't really interact with the blood pressure medication. So it's a good addition to their daily habits.
Yeah. So in my culture, in the Mexican culture, we use agua de Jamaica, so we call it. Right.
That's
so
the same.
exactly. But, usually we're used to, probably dousing it with sugar. So that's not true. But we make it in the same way. You boil those hibiscus flowers, and then you make basically a tea, and then we ice it, almost like iced tea. Right. And then we have that. So you're saying that could actually ideally bring down the blood pressure, but just without the sugar would do it. And that's good enough.
Absolutely. I guess both our cultures have seen that, and it has worked now in studies. There was one study I was looking at, there was 85 people with high blood pressure given hibiscus tea, and the others were given placebo. And 6 weeks later, the people who drank tea had significant decrease in systolic blood pressure compared to the placebo. So that really shows some evidence there, and there is other studies that can show significant P and N value there.
So I've got a question, which sounds like that's a great result there. On the show, Guillermo, since the beginning, has talked about that we need moderation in things. And so when you're talking about hibiscus teas, and that is once a day, is it once a meal? What can it be overdone, having too much of it? So what's that look like?
That's a great question to ask. Absolutely. There's no overdose on it. So about 2 to 3 cups a day is a good, I would say, dosage for daily usage without having any problems. More so, because when you drink anything that's liquid, of course, you want to avoid it before bedtime. You don't want to go to urination all the time while you're sleeping to wake up and get into especially like a hypertensive type of situation in the middle of the night. So other than that, honestly, there's no overdoing of it. And as I said, not adding sugar to it really is a key factor here. So that's one of the food, I would say more so like a tea or a diet thing that we can add. But there are so many other foods that we can talk about. And I think we should get into that too, so we can help our audience with some other foods.
I've heard like watermelon, for example, right, has a diuretic effect, and maybe that's why it lowers down the blood pressure. But you mentioned other things before, like kiwis, mangoes, honeydews, tomatoes. A lot of are they all working through the same mechanism, Dr. Shah, or are they all a little different?
They work differently because what we are doing essentially is reducing the amount of toxins also, and then increasing the, I would say, through diuretic effect, we're also increasing the excretion of the metabolites that are causing high blood pressure, along with lots of nutrition, which is vitamins, minerals, trace elements being fulfilled in the body. So it's a very huge cascade of combining different things that is adding to the value of bringing this blood pressure down.
Good. So it looks like there's a different variety of those. Like you said, you also mentioned citrus fruits, some berries, and more organic foods. So you're looking at, as we always talk about here on the Healthcare Corner, is we need to really think about, overall health and being preventive. So avoiding probably things that are processed, going along with more organic foods, a lot of different colors, a lot of greens, right? A lot of fiber, all those things will help in the overall, but also for the blood pressure. So, as we come back from the break here shortly, I really want to get into Dr. Shah because she is, remember, she's a pharmacy doctor. So I really want to get into which of these common medications that we use for blood pressure control and how some of these dietary foods may be able to get you off those medications. So we'll be right back.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner with Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah. Welcome back to Healthcare Corner, where you're a part of the conversation with your host, Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah.
Welcome back to the Healthcare Corner, everyone. And today we've talked a little more detail about blood pressure and what we can do. And I really liked the first section because we got into actual foods and things that we can do to lower our blood pressure without medication. So I know that common blood pressure meds are ACE inhibitors, beta blockers, diuretics, that sort of thing. So Dr. Shah, is there a way for us to understand which foods we eat that could maybe offset the need to take one of these common medications?
Absolutely. Let's focus on the diuretics because we already talked about the melons and teas. So they definitely work on the same lines of getting rid of a lot of extra fluid. And that's what really helps with maintaining the blood pressure because now we're reducing the resistance on the heart and kidneys. So that's definitely one of the ways where we can use these natural foods instead of the diuretics. And of course, it's not without permission of the physician who is overlooking, but definitely an option to look into foods as replacement to some of these meds.
Yeah, one of the other common ones is for me is those ACE inhibitors, and the reason I bring those up is because there's a lot of contraindications to ACE inhibitors and a lot of warnings. Right. So I always, even though they're very good for certain patients and like Dr. Shah alluded to, please don't go and stop your medications that we're talking about just because you're going to start eating, melons and taking hibiscus tea. please make sure that that there's a correlation between your blood pressure being lowered by some of these things. Because what we're saying is they're generalizations. They may not work for everybody. But it's really important to ACE inhibitors have a lot of contraindications, and because if you have certain kidney issues, you may not be able to take them. There's so many different types of medications out here. So one of the biggest things I always do is there any from your standpoint, Dr. Shaw, if somebody's on ACE inhibitors, is there any of these foods that we talked about that could interfere with its metabolism and how it works?
Honestly, there is no evidence on that, because you can even go and check drug and food interactions, and I haven't found any of that with ACE inhibitors. But in general, ACE inhibitors do have other reactions with other meds, and what essentially it's doing is it's preventing an enzyme in the body from producing angiotensin II, a substance that narrows blood vessels. So if you think about the mechanism of action, it's basically what we're doing is blocking a substance which is narrowing the blood vessels. Instead of doing that, we could do some things with the food which will help us with getting rid of toxin overload and excess fluid. Then we might not even need to go to the step 2, which is, when the diagnosis happens, usually the first go-to is the diuretics. And then when we do it again, the measurements, we add another drug, right? So I feel like we can catch it early on and we get some changes right there in stage 1.
Yeah, you brought up a great point. I always remember some of my patients that, came in with all this swelling in their legs, and some of our listeners may be familiar with this, and usually it's because of a starting of a calcium channel blocker, that also usually for blood pressure medication, as a blood pressure medication. So some of these diuretics you're talking about as foods in terms of melons and some of these hibiscus teas, some of these, may be able to offset maybe some of that. But, I wanted to remind our listeners that, this is why we've talked about here previously on the show. It's great to go see a functional medicine doctor like Dr. Shaw, specifically one that has a lot of experience with, pharmacology and now functional medicine. But at the same time, this should be in conjunction and should work together with your primary care doctor to be able to kind of be able to regulate, how much of which, what to avoid, what not to avoid. And this should always be in good communication. So that being said, I think it's, good to also talk about, like Dr. Shaw alluded to earlier, avoiding just salt, right? So, a lot of us like salt, especially the older we get, right? Our taste buds maybe need a little bit more of that. We think it's adding flavor, but it's also increasing our blood pressure, deep fried foods. And, we don't think about this, but unless you buy organic and the source of your foods, and it could even be greens, they could be using a lot of pesticides, right? So some of these pesticide-loaded foods could also cause elevated blood pressure.
Absolutely, it can. So just for our audience purpose, the ACE inhibitors we talked about earlier are the prils, right? The ones that end in pril, so lisinopril, ramipril, those are the ones we're talking about, just to make it more understandable.
Sure. So now that we covered that, I think we should just jump into the next thing, because one of the biggest problems I've seen out there also, and this happens a lot in young people, which I think it's really appreciated, is high cholesterol. And once again, I'm not talking necessarily about having a diagnosis of hyperlipidemia, because that also gets a little complicated. So what about just having high cholesterol? And people always say, well, you need cholesterol. And we talked about this here. You do need cholesterol to make, create new cells, for normal brain function, to actually even to make hormones that are essential. But, having too much of a cholesterol is also very bad. As we've heard here before, right, it can lead to plaquing. Some people probably have heard, well, pancreatitis. Well, some people I get asked all the time, my cholesterol's high. One of my father had pancreatitis because it's cholesterol. That may be one of the components, right? Triglycerides get a little high, you end up with a pancreatitis. But it can also, right? People are like, well, if I had high cholesterol, I'm going to have a heart attack. So there's all these things out there. So Dr. Shaw, why is having high cholesterol not a good thing?
Well, there's a lot of controversial theories on that, but I would say excess of anything is not good anyway. So we're talking about high LDL and high triglycerides here specifically, because we want to be clear on what are the bad cholesterols that we actually want to avoid. So why is it bad? Because it could cause calcification of the arteries. It can cause excess of calcium in the blood. And of course, we know that that can lead to other disease states, especially cardiovascular. And of course, with triglycerides, we know it can lead to vice versa, but it can lead, high triglycerides can also hurt our pancreas. So it's a vicious cycle to get out of, and that's why maintaining good levels, optimum levels, is what we need to do.
Yeah, and that's harder to do when you're doing it with medications, right? Because it's kind of hard to gauge how much a medication is going to decrease your cholesterol. So it's a whole lot better to do it with food. So let's get right into it then. Tell us what types of foods actually naturally decrease your cholesterol.
Red meat, right? Isn't that one of them?
I wish.
You would wish. Red meat is good occasionally because of what all it is kind of loaded with in the modern world of how we prepare processed meats. But going right into the good food that can really help us naturally would be fiber-rich food, both soluble and insoluble fiber. Specifically, I would say red yeast rice, wild rice, cruciferous vegetables, old-fashioned oats, beans, eggplants, almonds, fatty fish, berries. These are some really, really good fiber-rich foods that can help us with maintaining healthy cholesterol.
Yeah, I love all those foods that you mentioned. So, I try to eat as much of those as possible. But, sometimes, that's not quite enough. Some of us do have a genetic predisposition. And even when you're exercising and eating what seems to be appropriate, right, you still could end up with a little bit of elevated cholesterol. When should you really be worried about that? Well, if you also have a genetic predisposition for, say, cardiovascular disease or stroke, or if you suffer already from high blood pressure or diabetes, then obviously having high cholesterol is a bigger issue, right? So, if you're already eating all these foods, Dr. Shah, and you still have a high cholesterol, sometimes you need medication, right? Or do you think that we could control cholesterol with just the way we eat and maybe exercise?
Honestly, it's a question to be decided when you look at the labs, because in TREAM lab, when we see very high level of triglycerides and LDL, we should definitely consider something temporarily to help bring it down and then maintain it with lifestyle diet and natural foods. And that's what I would say is appropriate to do. But honestly, nothing like eating well and exercising, what it does to your overall health, not just cholesterol, nothing like that.
How about your age or the gender of the person as well? So is it different for women than men? Is it different for young people than older people? You're seeing a lot of children, I think, right, with more cholesterol from what they're eating. So how much of that plays into it?
Definitely men are more prone to cholesterol issues. It's also, I feel, directly related to our eating habits, because men do like carbs and red meat more. Let's be honest. And with kids, we're running into this whole new type of problem where the young kids are going through a lot of bad eating habits right off the bat when they're literally, right after their birth. And they don't know any better, and parents are really busy. That's what's causing a lot of childhood obesity and cholesterol issues in kids.
Yeah. Dr. Shah, we're all familiar with, we call them the statins, right? All these simvastatin, and torvastatin. So these are the common medications that people probably heard out there that, to take for elevated blood pressure. There is a few other reasons to take them, right? They're anti-inflammatory. They help prevent stroke and heart attack, is what we hear anyway from the pharma companies. But how important are those, and when would you say they're not good to take?
Honestly, when someone has liver issues or they have weak kidneys, they shouldn't be using those, because it's contradicted in these type of patients who have compromised liver and kidney, because they do put a lot of stress on these organs. So it is definitely something that we want to be careful with, and that's why natural foods and diet and lifestyle can play a real good value here for those type of people.
Yeah, I also read in this really interesting article once that people who taking statins, it was older, it was actually females over the age of 65, I believe, who were on statins had a 40% higher incidence of developing diabetes. And if you develop diabetes, you had a 74% higher incidence of developing dementia. So as we get back, from the break, we're going to get more into this and also go into the next hyperglycemia or elevated blood sugars. So stay tuned.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner with Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah. Welcome back to Healthcare Corner, where you're a part of the conversation with your hosts, Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah.
Welcome back to the Healthcare Corner, everyone. And I think before the break, we did a great job talking about hyperglycemia. With my experience in skilled nursing, Guillermo, you've probably seen it a lot as well, right? A lot of my patients had hypoglycemia, and
we were talking about
hypolipidemia, right? Okay, so you have hypo, right? So that low level, right? Break it down for somebody like me that's not as clinical.
Well, we're talking about cholesterol, and when we finished the break, we're talking about those statin medications. And I said something about people who are on statins, or elderly who are on statins, had a 40% higher incidence of developing diabetes. And if you have diabetes, then the incidence of developing dementia went up to like 74%. It was really dramatic. It was right around those numbers. And I think that the key there is that there's always consequences to anything that you do. And specifically in the elderly, one important thing I just wanted to finish off hyperlipidemia with is that, having too low of cholesterol seems to be a big problem, right? Because as we mentioned, there is a lot of functions, specifically hormonal, hormone production that you need cholesterol for. So if you also, Dr. Shah, as you're familiar with this, as you start getting older, making dramatic changes, trying to meet these certain number requirements, being too drastic is a bad thing.
Absolutely. And why it causes dementia, Dr. Castillo, is because your brain matter, all the material that your brain is made up of, is actually in need of cholesterol to create all that myelin sheath and neurons and the connection and the communication between them. So that's what keeps our memory intact, and that's why dementia is something that we have seen. So it's really important to look into different things and age-wise always keep track of the optimal levels for our patients and audience. So that's something that I would really emphasize on.
Yeah. And going into that brings us right into our next topic, which I think is probably just as important, if not more than all these, and really common, right, is high blood sugars. Again, not necessarily diabetes, but just having high blood sugars. Gavin said something about, the ADA recommends a reasonable goal for the A1C, again, to be around levels less than 7. This is for non-pregnant people. But once again, depending on, where you're at in your age, where you are in physically and how healthy you are, sometimes, sticking to these ranges and trying to be really aggressive to get down past a certain number isn't the way to go. So remember, some of these things that we mentioned, and these are just, recommendations or generalizations out there. Each individual should always look at their own perspective and their own well-being in terms of how aggressive they are with how they treat these things. Because sometimes going too far, especially with blood sugars, if you go too far one direction, right? If you go too low, it's also a really bad thing. And some people can die from hypoglycemia. So getting right back into high blood sugar, we all know, we all hear it all the time. Why is it a problem? Well, specifically with most people who have blood sugar issues, right, is the fact that it's hyperglycemia that's the issue. And, specifically with type 2, with type 1 diabetes, it's easy because you catch them really early, right? Their pancreas doesn't work and they can't process. Now they can't create insulin. So they come in with this big hyperglycemic event and it's really easy to catch, right? But with type 2 diabetes, which is the most common, it usually takes years and years and years of high blood sugar before you start seeing some end organ damage. So by the time they really present to us, they usually have a lot of other problems, either like I said, neuropathy, retinopathies, as we mentioned about, so eye issues or kidney issues, or or sometimes they come in and they have heart issues, so they're already having heart attacks because they have a high cholesterol, high blood pressure, and cholesterol that now is attached to sugar, right, is what is the main component of these plaques in the arteries that then lead to heart attacks. So right. So, and most people, I don't know the statistics on this one, Gavin. Usually leave those up to you, but there's a huge percentage of the population out there that actually have probably diagnosable diabetes, but aren't diagnosed, right? Probably because they're not following up, or they just not, seeing the doctor at the right time when their sugars are really high. So that's also a big problem. From your perspective, Dr. Shah, how do you then address people, even if they're not coming in with high blood sugar, right? How do you address them from a functional medicine standpoint to keep those blood sugars controlled?
So blood sugar being high is a constant issue, right? Our organs are constantly dealing with oxidative stress that is created from this sugar-loaded blood, which is also a very, very, I would say, a huge magnet for microbes to be attracted. Because think about honey or any like sugar solution outside, it attracts a lot of bugs. It's just the same thing. So how do we help them? Now, we are producing high levels of sugar in the blood because of how we are eating and managing our lifestyle, right? So because of obesity or the type of diets we have, what happens is either pancreas get inflamed and they start doing subperformance, which is not giving us proper insulin, or the cells have adipose tissue, which is a lot of fat layer that gets created in the cellular level, which will resist the insulin from being used to actually process the sugars, which is the glucose in the blood, if that makes sense. So there's two different ways where we are actually getting bombarded with just sugar staying in the bloodstream.
So Guillermo, to answer your question about percentages, almost 23% of all adults that have, what did the CDC say, a prevalence or their lab results were met what diabetes looks like, did not report having diabetes. So, gosh, of the 37 million people that suffer with diabetes, 8.5 million of those in numbers have no clue. So that's something where I think, awareness, proactive health, those signs and symptoms that you're talking about are so important for us to get out that message.
That's a quarter of the people out there that have diabetes are living with diabetes without knowing that they have it. That means that they're not doing any of these things that we're talking about to really help them overall reduce the damage. And like I said, even though it takes years, that if you're living without knowing that you have elevated blood sugars, then you're causing more and more damage over time, and most of this is irreversible damage, as Dr. Shah alluded to, right? It also, the biggest issue is how they usually present is they come in with infection. They have a UTI or a skin infection or something like that, and they're like, well, I just keep getting these cellulitis or skin infections, and then they're like, oh, your sugar is 500. And then check an A1C, and their A1C, their hemoglobin A1C is like 11.3, and normal is like below 6.2. So you're like, oh man, you really have had diabetes for probably 20 years, and they're always shocked. This is the thing. They're like, oh my god, I would have never known. And
if I hadn't come in here, I never would have had it, right?
Yeah. That's also one of the things, and culturally and in the way I grew up, they would say, if I was just fine until I went to the doctor and they told me I was sick. Right? You're like, nobody knows, because some of these things don't present until it's really a little bit late. So, what kind of foods, Dr. Shah, can we really start taking, or can we maybe not just avoid, but is there anything that, food-wise that will help us that regulate blood sugars?
Absolutely. Just like how we talked about hibiscus tea with blood pressure, we can really focus here on cinnamon. Cinnamon is one of the herbs that has lots of studies now proving getting more traction on regulation of the blood sugars, and the mechanism is still unknown, but what has been seen is that it just makes insulin more, I would say, at function. Basically, it's improving the function of insulin to do the job that it needs to do. So that's one thing I would really focus on, is cinnamon as one of the main ingredients to start getting traction on this.
And we're not talking about cinnamon rolls, right? We're talking about other types of food that are probably much better, right? So what are maybe some, like maybe recipes and that sort of thing that include cinnamon in a different way, or?
Yeah, absolutely. So there's two ways I recommend to my patient population. One is in form of tea. So you could literally boil cinnamon, high quality Ceylon cinnamon from Sri Lanka or Sourcewell organic. You can boil it and then let it cool down and strain, and add a little bit of lemon and maybe like a pinch of honey to make it nice and palatable, and that about a couple times a day. Or even cinnamon capsules that are high quality are available.
Yeah, it's funny when growing up, and still to this day, my mother, anytime anybody's complaining about anything, she makes a cinnamon tea. And if you have even a little scratch in your throat or runny nose or something, it's a cinnamon tea with lemon. And there's all these remedies that you never would think of, and they probably didn't know the science behind it, but it seems to work, right? And sometimes your body craves it. I add cinnamon to my coffee every morning. I don't know if I'm getting enough cinnamon there, but I love cinnamon. I think cinnamon should be on the table kind of with salt and pepper. It should be another condiment because I can put it just about anything. I love cinnamon. But
absolutely. And that's the flavor, right? Even when we have the Mexican mocha, cinnamon is the flavor on it. So there's a reason why these flavors are being used around the world in dietary habits.
Yeah. Also increasing, like we talked about earlier, all right, these undigestible fiber-rich foods also help regulate blood sugars, and more than anything, exercising, because now we're talking about being more sensitive to your own insulin. So what happens when you start getting more fat deposits, you start putting on weight, is you get insulin insensitivity, and that's what we talked about in the last category. We talked about dementia. We talked about it before here on the show. Actually, dementia being a diabetes mellitus type 3. It turns out there is receptors in the brain for insulin. So, and you do get resistance. So some of those things, sometimes if you do have, any kind of memory issues, it could be related to, some elevated blood sugar, some elevated insulin resistance. So, as we get back, we finish this segment and get back, we're going to tie all this together and show you why, some people end up with high blood pressure, high cholesterol, and high blood sugar all in the same time, and why that's really horrible. But more importantly, we're going to tell you how we're going to be able to attack this immediately. So starting tomorrow, you'll be able to be better than you were today. So stay tuned.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner with Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah. Welcome back to Healthcare Corner, where you're a part of the conversation with your hosts, Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah.
Welcome back to the Healthcare Corner, everyone. And this final segment always comes to us so quickly. And again, we're not always able to cover everything on the Healthcare Corner. So if you'd like to learn more, go to hcshow.net. Like and subscribe us wherever you get your podcasts, and really join the conversation. We want to hear from you. We want to be able to answer your questions. And this episode, we've kind of painted a little bit of a bleak picture here. We've taken high cholesterol, blood pressure that's high blood sugars, all of that. And individually, they all sound pretty scary. But Guillermo, before we came into the segment, you said many times it's very common to have a person with all three. So if one's bad and many people have all three, what can we do? How are we able to really attack all three of these things?
Yeah, you said something that's really key, is that the reason why it's hard to find one of these just individually, not the others, is because usually we're making, like Dr. Shah said, we're making lifestyle decisions that lead to, elevated cholesterol. And normally that's the same lifestyle issues that lead to high blood pressure and high blood sugars. So, and the reason we're saying, high blood pressure, high cholesterol, high blood sugars, and not, hypertension, hyperlipidemia, and diabetes, is because, like we just talked about, many of you may not have this diagnosis, but you still should be super concerned about, maybe suffering from these, and maybe we're just not capturing you well enough, because I don't know how engaged you are with your physician, but if you're not seeing your physicians enough and frequently enough and paying attention to these things, they may not ever be caught until you have some end organ damage that may be then difficult to treat. So remember, we're here being proactive. So why does it happen in common? Well, because they have a lot of things in common. Like Dr. Shah alluded to, it's basically, hey, if you're not sleeping right, if you're eating the wrong things and you're not exercising and you're doing all, you're probably going to end up with one or two or three of all these things. And in conjunction, they're really bad. So we talk about here, cholesterol, sugar, and blood pressure all will lead to maybe strokes, heart attacks. And more than anything, one of the guys, I don't know about you guys, but one of the things I fear the most is dementia. I'm afraid that I'm going to be physically okay and have completely lost my mind. All right. So that would make me very difficult to handle. And I've seen it happen. And it's funny, but it's not funny because it's tough. It's tough to deal with that,
scary.
especially for families. Yeah. Right. And nobody ever wants to be a burden on their family. So how do we avoid these things, Dr. Shah? What can you tell us?
So what I would say, Gavin and Dr. Kassir, is because of the current system that we have, they put all of these things together and then just call it metabolic syndrome, and then just put people on a bunch of medications. And that's not the approach. We don't have just a pill for all the ill out there. What I would say is we need to really focus on the root cause of this, where it's coming from. What is the gut microbiome of this client? What is the sensitivity of insulin? What is their blood pressure levels, or even their glomerular filtration level, which is how their kidney is performing, metabolic panels? There's so much that goes into understanding, and then helping them on a whole umbrella of lifestyle modification with very basic meds in the beginning that can help them quickly gain traction on their organ health. And then, of course, maintaining long-term with diet, lifestyle, and coaching is what I would really suggest to do. And that way we can lead into what are some quick things that our audience can do to start feeling better or adding to their daily habits.
Yeah, and Dr. Shah brings up a lot of great things, and she just reiterates everything that we preach here. Gavin and I have been preaching here for over a year and a half, and thank God Dr. Shah now agrees with us. But
that's right.
Right, it's all.
Hey, I believe from the beginning. You too.
It's all about doing the right thing. So because we've always talked about diet, we always talk about exercise, we talk about sleep. So all those factors that lead to overall wellness obviously are going to improve each one of these things, and all of them together. Right. So, but more importantly here, we always like to get into, hey, what are some of these things that we can do? What can you do tomorrow that's really, okay, they're going to be simple. They are simple things. They're not going to be easy, right? Because, changing habits is never easy, especially when we have addiction, and one of these addictions we talk about here all the time is addiction to sugar. Sugar is a huge addiction. It's a drug. So, one of the things I see on our list number one, Dr. Shah, is removing fried foods and soda. Right? Maybe fried foods would probably be easier than soda. I don't know the statistics on soda, but I know Pepsi and Coke do very, very well. So, yeah, Dr. Shah,
absolutely.
How do you get your people, Dr. Shah, to just drop soda?
It sometimes takes my people, especially my clients, to go through something major to even really start changing their lifestyle. And I just had recently one client who ended up in the hospital from drinking Coke about 3-4 times a day continuously for a few years. And her liver enzymes were 10x than the normal levels. But she dropped drinking Coke in a day after being hospitalized. Now, that shouldn't be the case. So now when we're talking over and over, each episode after episode, I feel like our people should really start making efforts into at least reducing. If they have 3-4 a day, cut it down to 1, and then maybe every other day to none. It's tapering down that I really suggest.
So when you look at sugar and 5 grams equaling a teaspoon, water obviously has no sugar in it, but Fused Tea, as an example, has 19.2 grams of sugar. Vitamin water has 27 grams of sugar. And then you look at kind of the big hitters are actually, it's not Coke and Pepsi, it's actually Fanta. So Fanta comes in at 44.1 grams for a can.
That's why it's so delicious.
That's right. And grape actually more than orange or pineapple. So if you're going to go big or go home, I think Fanta grape is what is the biggest one. So, I mean, just think about that. If you can cut out 3 or 4 times a day,
that's a lot of sugar.
That's a lot of sugar.
Yeah, that's a big one. And maybe it's kind of like getting people to stop smoking. They say, like, this is what I learned when I was studying for my boards, is they were saying that if you just bring it up, if you just talk to your patient, you get almost a doubling in the quit, right? So I'm not saying you go from 25 to 50% or you do that, but maybe you go from 1% to 2% of people will actually stop. Yeah. But you got to keep repeatedly tell them over and over again. That leads to the next one. So reducing salt intake. I think that one for me is relatively easy, just because there's so many now substitutes for salt that don't have that same effect. So you can still give food a real taste, a really good taste without increasing that salt volume.
So allegedly, sorry, Doctor.
Well, I was going to say, to add to that, maybe just switch it to Himalayan pink salt or kosher salt and use less of it, but definitely more cleaner options out there.
So if you look at all the consumption of salt, apparently 71% of all salt is in processed or restaurant foods, and 14% of all consumption is naturally occurring. So really, it's something where all the foods that you mentioned beforehand, if you just stick to things that are natural, you're going to be much better off than the processed and things you find in the restaurant.
Absolutely. And as we talked about already, but hibiscus tea, I love that hibiscus tea anyhow. So remember, without sugar though. And then also cinnamon tea, with a little splash of lemon juice and maybe a splash of honey, but keep the sugar low. Also, one of the things that I like here, it says adding nuts and seeds. Obviously probably unsalted, because those salted and caramelized ones are delicious, but they're probably not good for you as well, right? Omega-3 fatty acids, salmon, sardines, albacore, tuna. Sometimes those are harder because they're actually pretty expensive, and it's hard to find good, that are free or wild caught, they say, right? And sometimes those are pretty pricey. But other things like skinless chicken, skinless turkey, tofu. I don't know. Do you guys like tofu?
It's an acquired taste, I think, for some.
I think it depends on how you cook it.
It depends on how it's prepared, I feel.
Yeah.
If I don't know it's tofu, I'll have it.
Yeah. But, more importantly of all those things, those are things to add, right? So we talk about, sometimes we're also in a rush and we're trying to get things in quickly. And some of the things to really avoid that I like this list about things to avoid, Dr. Shaw, is, deli meats, bologna, salami, ham. They're delicious, right? They are high in salt, and because you need to be preserved. Hot dogs. Oh, I love sausages, but sausages and pepperoni are bad. Yeah. Beef jerky. High in salt.
Sure. Well, why is turkey okay? I think it says in deli meats, turkey's is usually a better option.
I don't know. I think maybe they don't use as much salt, but it's usually smoked turkey, and smoked meats are not supposed to be good for you either.
Gotcha.
For a bunch of other different, you just have a whole nother show on just smoked foods, because I love smoked foods, but they're not great for you either.
Yeah. Don't listen to the show around lunchtime.
Yeah. And it says bacon is a bad choice on this list, but I love bacon.
Yeah.
Dr. Shaw, what can we do to replace bacon?
That's a very difficult question. I would say go with, at least if you do like bacon, go with the high quality non-processed one, which I don't know if it's available because I don't eat red meat, but I'm sure if you go to Natural Foods store, you could find something. That's where it gets tricky, is things start getting expensive too.
Yeah. And one of the things I think is really people believe are being healthy is drinking smoothies or juices. That when you juice something, you get all the sugar and some of the flavor, but you remove a lot of that fiber, a lot of that good stuff from those fruits and vegetables. So sometimes that's not the healthiest thing, right? To do smoothies, and even these protein shakes can be pretty high in sugar. So that's difficult, right? So maybe eat the whole fruits and vegetables. I don't know what else could you do. Every so often, maybe a fruit smoothie or shake would be okay, but not on a regular basis, right, Dr. Shaw?
Absolutely. I would say even if you did have fruit smoothie, add fatty fruit, like vegetable, like avocado to it to compensate, because it all depends on how you balance, right? Even with smoothies. So different things have to be looked into, and that's why we need to do some more follow-up episodes on how to manage these disease states better.
Certainly. And I think one final thing that I learned this week was, if I want to really change my diet and eat home more and not maybe go out and have processed foods as much, then typically half of the meal should be some kind of non-starchy vegetables. Maybe a quarter of the plate should be kind of that good protein that we're talking about, or a plant-based source. And then finally having that grain or starch, maybe like that vegetable, fruit, or a glass of milk. Would you add to that at all, Guillermo?
No, I think it's really important to remind our audience that, high blood pressure, high cholesterol, high blood sugars, even without the actual diagnosis of these, is something to really worry about. I think that's a take-home message. Really be proactive about your health and really start adding these and removing some of these things that we just talked about to really just live a better quality of life. And remember, it's all about long-term. We're playing the long game here. We're trying to help you be proactive and end up with a better quality of life for the rest of your life, whatever that may be. So just for everybody here at the Healthcare Corner, thanks for listening, and we really appreciate you. And we're going to continue to bring you all these great episodes with as much information as we can. So thank you again, and we'll see you next time.
See you next week.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner with Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah.